Healthcare providers are facing an unprecedented talent crisis, forcing organizations to reimagine how to provide care, staff critical services, and support the workforce. I'm Greg Thomas from Workday, and I'm joined today by Vince Vickers, Principal and National Healthcare Consulting Leader for KPMG. We're going to discuss the roots of this challenge and how technology can help engage, retain, and empower workers so they can focus on delivering quality, cost-effective care. Vince, welcome, and thank you very much for being here.
Thank you. Glad to be here.
Why don't we just start with a simple question? Tell us a little bit about yourself and your role at KPMG.
Sure. I've been with the firm for 9 years now. As mentioned, national leader for healthcare for the U.S. But my background is 30 years in healthcare. Started my career back with Humana in the early 90s and have been here ever since.
Cool. So let's get into it. So to say it's been a challenging couple of years for healthcare is just a massive understatement. What does the talent and HR landscape look like today?
Yeah, it's an unprecedented challenge, and there's been, pre-COVID years before already some trends that we were seeing with certainly nurse shortages as an example. We have an aging population, we have a greater demand for healthcare, and so the role of a nurse practitioner has changed significantly, and that shortage was already there. COVID has presented a whole new set of issues for us. So we have major burnout that's occurring, and it's not just nurses, it's physicians. The result of that is we're sitting here now where several surveys have showed that 2 in 5 nurses plan on leaving the workforce in the next 24 months, and 1 out of 5 physicians. And that's really not inclusive of that retirement group that was already naturally going to retire, and there was an aging population there. So it's a real challenge that we have right now.
Yeah, and I would think especially on the clinical side, you can't just drop someone in off the street. There's a vast amount of training and credentialing that needs to go into getting that clinical workforce.
Yeah, absolutely. And so that creates some stress on the pipeline, of course. And so we may want to talk a little bit about that. But in the near term, our most important asset is that group that we have, and keeping them there and improving their daily lives, compensating them appropriately, obviously, and providing technologies that help kind of make for a more frictionless day, reduce the administrative and bureaucratic tasks they have, because in fact, that's if you look at most surveys, ours included, as much as 50% of the reason that folks are thinking about leaving the workforce is because of those bureaucratic tasks they have and not being able to spend the time that they need in front of the patient.
Yeah, cool. So we'll come back to tech in a minute. So as you painted the picture, this is a challenge that's got long gestating roots. So what does the industry need to do to move forward from here?
Yeah, so I think there's a number of different things. We need to reimagine what the employee experience looks like. So there's a number of different things involved in that, but let's just call it a better work-life balance, right? We have to figure that out. The scheduling is a challenge, right? We're overworking them. So we need to spend time on that work-life balance. Again, on the compensation benefit side, there's things we can't keep increasing pay and just leave it at that. And that's what we've really done throughout COVID. There's actually some stats out there that showed a number of folks, and nurses would be the best example, that left the workforce, went into the traveling nurse profession, right? So we had 100,000 or so traveling nurses at one point. That was kind of the peak during COVID, and we're paying them $5,000 a week. That is not sustainable when you look at the cost impact and knowing that healthcare organizations' cost is as much as 60% associated with labor. So if I'm adding 30% plus costs, right, that's unsustainable. In particular, in an industry where we're talking about 2 to 8% margins to begin with. So we've got to figure out that compensation. We have to be more creative in it. We have to provide the right incentives, and then present a more holistic benefit solution for them as well. And then the third, which I've mentioned already, and I know you want to get to, is the technology side. If you look at where we've invested in healthcare over the last handful of years, there's a lot of good stories in technology in terms of the investment. Most healthcare organizations today have chief digital officers, especially the upper end of the market. Digital is a key component of their business strategy, and you wouldn't have seen that as little as 5 years ago. I think the experiences that we had with moving towards more telehealth during COVID, where we had to do more things virtually, kind of helped us embrace technology better, and all of our surveys are showing that. However, as much as we've focused on the patient, we have not focused much on improving the lives of the employee and the employee experience. And that's where kind of that next phase of technology investment really needs to come. And I think while it's not, a silver bullet, if you put it together with the other two items I mentioned, it certainly can help with at least preventing this increasing shortage that we have.
Yeah. Well, and it does feel like it's all part of the same puzzle, right? There's no one lever that someone's going to pull to fix this problem kind of magically.
That's right.
So talk a little bit more about technology and how it can help, those providers, but really probably everybody in the healthcare environment, who struggles with those challenges around burnout and scheduling, everything you talked about. What's the role of tech?
Well, I always kind of point to the simplistic things, right? If I'm talking to my mother or somebody and we're trying to just get very basic about, well, Vince, what do you do every day, right? It's imagine yourself and your regular experience of going in and just meeting with your family physician, right? And what does that look like? Well, immediately you see a lot of paperwork, right? Some of that's on you, and that creates a poor patient experience. But if you look at who's taking that paperwork and then passing it around amongst multiple systems, and then how that finally gets to the nurse practitioner, or the physician, and then their use of that, and finally somebody entering it into a system, maybe multiple systems. If you just kind of think about that process, it's terribly cumbersome.
Yeah.
There's really no other industry that still is functioning like that.
And so rife for manual error.
Yeah.
Right?
So in its simplest form, that process needs to look and feel like what we do in the rest of our lives every day, right, as consumers. So that's the simplest. Now, you can get more specific on the emerging technologies. A good example is now RPA, robotics, right? So what are the things that we can do for nurses, for physicians, that can be done with software robots, as an example? And again, reduce some of that administrative tension. Ultimately, we need a more frictionless process for the employees and in particular our caregivers, for us to really get costs down and address this shortage issue.
Yeah, and you mentioned earlier the notion of employee experience, and addressing some of what you were just talking about helps to improve that experience, but it's a much broader topic, and there are technologies out there now that allow us to really understand kind of what the workforce is feeling. Where do you think this employee experience kind of movement fits into the healthcare space?
Yeah, so again, now we're kind of going into a new level where some other industries have embraced it. Obviously, there's use of technologies like Workday, where with data, we're able to kind of understand the employee better. We're able to provide better for them because we get those feedback points, and because we have technology that's kind of helping us understand the employee and the experience that they want. And there's another component here, right, which we didn't hit on, which is a new generation coming into the caregiver profession now, who frankly has very different expectations in terms of what they want on a daily basis than maybe what their parents wanted, or the generation that's in between. So technologies from a traditional human resources perspective, but then some of these really upgraded talent capabilities that give us data and analytics that we didn't have before are going to be paramount for helping with this issue as well.
Yeah, and it seems to me that when in any industry that's sort of having to really try to find the best talent, anything you take, any friction you take out is just going to help. And if someone's looking earlier in their career, what do I want to do? Well, this industry's, far behind. And I try to imagine my own kids who are in their early 20s, like having to do paperwork, right? They wouldn't know what to do with it.
Yeah.
Just a different world.
No, and what's interesting is, while we focus, and as we should, on the caregiver, right, the frontline worker, I mean, frankly, there's a whole nother set of employees that are not on the front line, but they're still crucial for our progress, and also are in a competing kind of labor war and talent war right now, right, as the unemployment rate is so low. Yeah. So even if I may be a financial analyst, or maybe I'm somebody that works in human resources, or maybe I'm somebody out at the dock working on materials management, all of those individuals have other opportunities in other industries that really are in a better position right now to help them with that employee experience, and especially the younger worker. So to get the best people across these healthcare organizations, even outside of the frontline worker, and to be competitive, we have to provide those kind of tools.
Yeah. So let's take a step back from we've been talking about some of these HR trends. If you're an HR leader in the healthcare space, what advice would you have to them about just how do they evolve their operating model to address these challenges, to attract the right talent, and to just be moving their organizations forward?
So I think one thing is just out front is getting some collective agreement at a leadership level that while yes, we want a patient-centered organization and a patient first, the employee is not last. Right? That's the way I'm kind of saying it. I haven't quite gone to the point of saying employee first. There certainly are some industries that have embraced that and say if I've got a happy employee, then I'm going to have a happy customer. Right? There's a number of industries that embrace that. I'm not sure that we're quite to that extent, but they shouldn't be last. They shouldn't be an afterthought. Right? So we have to have leadership in healthcare that really understands that dynamic and how important the employee and their happiness is. And it shouldn't have taken us kind of this shortage to force us into that box, but that is where we are. Yeah. So that's first and foremost. Then secondly, we need to think in a very innovative way. Now, while there are things we can learn from other industries, there are some things that are unique to healthcare, and that means a lot of creative thinking. We're doing a lot of brainstorming sessions where we don't, as consultants, necessarily have all the answers yet. We're trying to bring ideas from other industries, but there's some things that are unique to healthcare. And so I would just say more broadly, embrace innovation, which does not necessarily always mean technology, right? We talked about the technology side. In some cases, to your point, it means organizationally changing the way you're structured to be more efficient. It means changing some of your business processes. In some cases, it means really rethinking a lot of policies. We traditionally in healthcare have a real adverse reaction to change. It's always been part of kind of our DNA. We need to rethink that. We need to embrace it. I do think, interestingly, we're at a point where we've embraced change better than we ever have. We had to during COVID, right? It forced us to do things. Again, I think I keep coming back to the telehealth example as being just such a great overnight success, but it was only because we were forced to do that. I think we're in that same situation with respect to our employees right now. And we're up against a wall, and we need to come up with some good innovative solutions structurally, process-wise, and again, policy-wise that we've not thought of before.
Yeah. Well, I think your telehealth example is a good one because it strikes me as one of those technologies. It's been around for a long, long time. I didn't have my first telehealth appointment until 2020 because that was the environment that we were in. And so, yeah, crisis has a way of forcing change.
And in fairness, one of the issues that and this is another challenge with the industry, right, is there is a different payment structure, right? So one of the reasons that we didn't move to telehealth quite as fast as we could is because of regulatory and then the payment cycles and the payers themselves and how we reimbursed on telehealth. Obviously, the government lifted a lot of that. They're going to need to rethink that moving forward. But that's one of the challenges that is limiting sometimes for healthcare is kind of this bigger picture where we operate differently than other industries. All that being said, again, I think the workforce shortage is a crisis, maybe not to the level of the pandemic, but it is one that's very similar, and it will ultimately, it becomes more than a cost issue. It will ultimately impact our quality of health, for our kids, for our parents who are going into a new cycle. And then, by the way, we haven't spoken about it, but we did today in our earlier session is the underserved population. One of the things that COVID really pointed out was access to health by underserved populations, which ultimately ends up having a bigger cost for us down the road because chronic conditions are there that could have been more preventive. So there's a lot here, right, in terms of more than just the labor shortage that's challenging for healthcare right now. But I do believe we can get it right if we think more innovatively.
Yeah. So talk to me a bit about how HR should work with other peer organizations, IT, finance. any others you think that are relevant to help address these challenges?
Yeah. Well, I think one of the good things, and I would call it over the last handful of years, I maybe couldn't have made this case as much as 10 years ago, but I do think there has become greater and greater recognition of what was going to be a challenge with the workforce, right? It's obviously been accelerated with COVID. But as such, the HR organizations in most healthcare, they have a seat at the table right at the C-suite. They're typically reporting to the CEO now, and there's a recognition of how important an issue this is. So that makes for an easier conversation with their peers in other areas that you're talking about, whether that be finance, supply chain, clinical operations, to be a really good partner for them. I don't necessarily see a ton of friction there. There are obviously some organizations that perform better than others, but I'm really proud of what I've seen with kind of that CHRO leadership that's really evolved into that C-suite. The other thing I would bring up is, interestingly, there's been a dynamic, and I don't really have numbers that necessarily show this. It's more anecdotal, but very noticeable, is the number of new HR leaders, in particular the CHRO at the top, that have come from other industries, that have come outside of healthcare and maybe didn't grow up within healthcare. They are supported by people that know healthcare because of the uniqueness, but they're bringing some interesting perspectives that we otherwise wouldn't have seen. But I think the relationship across functional areas, generally speaking, is pretty healthy right now, and there's a good deal of respect for the challenges that HR is faced with and an understanding there.
Yeah. So what about, you spoke a little bit about this, Vince, but the role of data and how it's informing the way that HR leaders are thinking about those policies, about the compensation, listening to the employee. How do you see that having changed maybe over the past couple of years, and where do you see that going in the future?
Well, again, we had a great session today with two clients who were panelists, and one had just completed their ERP implementation, which was Workday and inclusive of HR. The other is in the process, and you could even see the dynamic going on between the two, and one being so excited to get through the next 18 months to 2 years to get to the point where they had the data that the client who had just completed their implementation had, right? And there were a number of different reference points on how they're using it. And just little things. I mean, it's as simple as, because of the large acquisitive activity that's gone on in healthcare, there are organizations that, frankly, don't know the workforce that they have. I mean, that sounds simplistic, right? How many employees do we have right now?
Yeah. Right.
That should be a pretty easily answered question, right? But in some cases, it is not.
Yeah.
Right. And then, of course, there's a contingent workforce, and there's a number of other challenges, right, in terms of that extended workforce that healthcare organizations have that aren't necessarily employed, but that are important, right, to the workforce strategy. But I think where I was going is, I think in the end, there are technology capabilities that are producing some level of consolidation to data that maybe they wouldn't have had without a cloud product like a Workday. Now, all that being said, you still have to do something with the data once you get it. So maybe, the basic answers of, I know how many employees I have now, are there, but there still is more data, and how are you going to harvest that to really kind of go back to this employee experience situation, to make further improvements, and how are we thinking innovatively about how to use that data? So analytics, not just the data, right, but how we're analyzing it is a crucial next step as well.
You talked earlier about the talent shortage. Some of it is folks who are just aging out, but others are leaving because of burnout and other risks. What do you see needing to happen to make sure that HR is attracting that next workforce that's coming down the line?
Yeah, so there's a lot of dynamics there that we're going to have to continue to strengthen our point of view on, in terms of how to exactly best help, right? So we know the kind of current state. We know that there's a little bit of a bottleneck in the pipeline. Some of that is generational. Some of that, again, is looking at healthcare going through COVID, and is this something I really want to get into? Some of that is a shortage in the university talent, the number of people that are actually entering universities and the projections around that. And then frankly, the instructor and capable instructor supply to kind of nurture that next group that's coming in. So there's kind of a supply chain issue there that is going to need quite a bit of work to address it. But again, I think if we can get some of these near-term issues figured out, I'm pretty confident we can figure out that front-end supply chain issue, because I think it will show that healthcare is in fact a great place to work. Some of those things need to be addressed, right? To really, again, get this attraction to this is something that maybe I always wanted to do. I love the idea of being a healer, being somebody to be a caregiver for, and so many people are passionate about it because people they've lost in their own family, right? Around certain specialties and that kind of stuff. But we have to give them a place that they feel really comfortable exercising that caregiving activity in. And I think that will be a huge component to helping with that supply chain.
Well, and it's a calling, right? Like a lot of people come to healthcare as maybe some other fields like teaching because they really want to help and they really want, and so, how do you...
If you're going into healthcare for the money, you've gone in for the wrong reason.
Right,
I think those today who are going into the profession, for certain, this is a calling for them.
Yeah.
So we just need to give them a home that's safe, that they feel good about, that they're not stressed over, and that makes them want to do it for their lifetime and not just for a few years.
Right. It's a career, not a job, right? Vince, talk to me about the current state of the supply chain. I mean, that was a big story during the beginning of the pandemic. We all see it in our daily lives. The supply chain stuff has not fully sorted itself out, to put it mildly. What's the state of it in the healthcare industry today?
Yeah, so it's definitely been a little overshadowed of late by the labor cost issue and the labor shortage issue, because certainly labor is a much larger component of cost. And so it's being overshadowed a little bit.
Supply chain is number 2, right? After
supply
labor?
chain is number 2.
Yeah.
And we definitely had some real challenging points early in COVID, right? Simple things like masks, right?
And PPE.
Simple surgical supplies, that kind of stuff. I think what you're seeing now is there are issues. There are issues for certain. I don't think they're at a critical point. They're disparate in terms of where those issues may lie. Obviously, if there are kind of underlying surgical components that are coming from another country, China or something like that, there may be more challenges than something that's built in the U.S. So there's some of those same challenges. I don't think we have some of the same challenges necessarily, and it's at a peak level that we might have seen with, say, microchips, right, or something of that technological level that's impacted the automobile industry. I also think, fortuitously, there's a number of folks that have implemented much more robust technologies and supply chain organizations in healthcare in the last handful of years, kind of right in front of COVID. And that helped a little bit and still continues to help. They have had to rethink some things around, kind of key components. If you think about it again, going back to mask and PPV and that kind of stuff, about what safety stock actually means, right? Mm-hmm. And so they've had to rethink some business processes there, develop some new relationships. The suppliers for healthcare and that structure with GPOs, group purchasing organizations, is a little different than a number of other industries. And so I think they've been able to kind of work through some things and collaborate a little bit better. But it just hasn't necessarily reached the same critical mass that we've had with labor.
Yeah. So it's still out there, but not maybe as acute as it was a couple of years ago.
Yeah.
So finally, for folks watching, like, what advice would you give them as they're thinking about their own organizations and the journeys that they're on?
I'll go back to a couple of the key components we mentioned earlier. We need to think more innovatively. I know that that's a challenge for healthcare traditionally. We need to embrace change better and faster. One thing we can't do that, say the technology industry can do is we can't throw enough risk into the situation that it puts our patients and our health at risk, right? So we can't try things and fail and try and fail fast, right? We're kind of not in that
a really good point. That's a really good point.
availability, and so that challenges us a bit more. But we can come up with some innovative ideas. We can pilot them in ways that don't impact our patients. And I think we just need to be smart about it. But I continue to believe that innovative thinking about some things from outside the industry where possible, and pushing the envelope to embrace change is really key to our future in healthcare.
We've been talking with Vince Vickers from KPMG about healthcare today. Thank you so much for watching.